In the early 1900s, there was a doctor at Harvard that said, wow, maybe we should collect our results and allow that to be public so patients know if they come and have an operation, what the result might be. Guess what happened? He presented that to the board at Mass General Hospital and he was shunned. He ended his career working at another hospital because the physicians at that time were not interested in that. It took over 100 years for this to be adopted. And what we've done now is adopted a program not to ask the doctor how they're doing, how their patients are doing, but to ask the patients how they're doing. We can see if these patients are actually doing well. So once they've been discharged from care, if we see a change in their answers, it may allow us to address it. They're not coming into the doctor anymore, but we can see that they're having a problem, we can address it. So patient safety will benefit from that. The doctor can look at his own outcomes, and through our system, we can compare it to each other, we can compare it to worldwide. We can do good research with that, and we've talked about how research helps us improve patient care and education. But research, again, without using patients' names, we can study certain things like stem cell treatments, like knotless surgery treatments, like outpatient total knee surgery. All the things that we think are going to make our care better, we can study to see if it indeed makes a difference. We can see if there's value in what we do. Well, what is value? Value is quality over cost. So insurance companies, hospitals, we all know what our healthcare costs, but we want to know what the real value of a certain treatment is. And by looking at their outcomes, we can look at the quality. In other words, if a treatment we're doing shows its good quality outcome, we now know the value of that treatment, whether to adopt it, whether to ask insurances to cover it. We think that's going to help patients. We're real proud here at Andrews Institute to be doing patient-reported outcomes, and hopefully it will allow us to continue to be leaders in the field.